everybody, I'm Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my channel, Navigating the Business of Medicine. Today we're going to talk about MACRA, QPP, and MIPS. It's going to be a very basic overview, but hopefully it will create a strong foundation for you to build from. And I'm going to put a link to CMS explaining all of this in the description, and I encourage you to go visit that website and really dive into getting a strong understanding about this whole program. If you're a private practice owner, and you have been for a while, then you're probably pretty familiar with MACRA and MIPS. If this sounds familiar to you, but you have no idea what it entails, then that's perfect, because that's what we're going to talk about today. Even if you think you might understand, I encourage you to still watch, because it's definitely something that affects most providers who see Medicare insured patients. So grab your favorite beverage and let's jump in. Whether you're new to medicine or you have been in medicine for a while, chances are Medicare reimbursement has always been a topic that everyone, including your colleagues and your managers and billing department, have all discussed at length multiple times. That is because Medicare is always changing their requirements, their reimbursement, and it definitely takes a lot to stay on top of. So before 2015, providers who saw patients insured with Medicare Part B were reimbursed based off a calculation called the sustainable growth rate. Well, because of the increased aging population and more people going on to Medicare insurance, the government decided it wasn't going to be able to continue reimbursing providers at an efficient and sustainable amount for their services, and knew that something else needed to be done. That's when they started exploring and deciding that instead of reimbursing providers based on how many Medicare patients they see, they wanted to shift it and make it more based on value and quality of care that they're providing to Medicare insured patients. That's where MACRA happened. MACRA is an act that Congress came together and they created the reform for the way that Medicare services were reimbursed. It went to the Quality Payment Program, or QPP. Now within QPP is MIPS, or Merit-Based Incentive Program. Basically, it's a more detailed approach of how they are going to reimburse providers based on certain criteria that they have a little bit of say so that they can get reimbursed more for seeing Medicare patients. Okay, that's a lot of words, so let's kind of recap. Since 2015, CMS has changed the way that they incentivize providers who see Medicare Part B insured patients, and it went from quantity to quality. And within that quality, there are more specific criteria, some in which providers get to choose, that they want to make sure that they focus on and provide to their patients and ensure they're getting proper care. There's also an APM model, and it does coexist with MIPS, but there's a lot of different levels and moving parts, and I'm not going to go into that today, but the website does, in that link in the description that I'm going to provide to CMS. I encourage you to go look at that and to really dive in and see if that's something that would benefit your practice or yourself if you attest as an individual. So let's say you're a provider who sees Medicare insured patients, which most providers are. The first thing is you need to make sure you use a certified electronic health records system or technology. They call it CERT, another acronym, Certified Electronic Health Record Technology. So in the early stages of setting up your practice, you need to make sure when you're looking into EMRs or EHRs that you ask if they are CMS certified. That's question number one. If you're not sure still about the difference between an EHR and an EMR, luckily for you, I've released a video about that. So go on to my channel and look for that video. It will be helpful for you in this area. 2, if they are certified, the next question you need to ask is if they will track and monitor your progress for MIPS. This is really important because you're going to assign someone in your clinic, whether it's a medical assistant or a manager or maybe even yourself or another provider, to monitor your progress in your MIPS, and also someone who makes sure that it gets attested after the 12-year reporting period. The third question you can ask is if they will attest and report it for you at the end of the capture timeline, or if you or your representative is going to have to do that on your behalf. If they charge a little extra for this, I highly encourage you to pay it because it is almost a full-time job to collect all the data and submit it to CMS the way they need it submitted in order for you to qualify or to find out if you qualify. So if they will do it on your behalf, I definitely encourage it. So you're a provider and you bill out Medicare Part B patients, then you're going to have to see if you qualify for MIPS. There are 3 criteria that you have to meet in order to be required to attest for MIPS. Now, if you're opening a new practice or you're still growing your practice, chances are these 3 criteria, you're not going to have a good idea whether you will have to attest or not after the 12-month period of collecting the data. So I would always assume, if I were you, that you are going to have to attest. That means have your staff aware and yourself and your other providers, and assume that you're going to have to attest, because it would be horrible if you get close to the end of the year and you realize you're hitting the 3 criteria and you don't have those marks for you or your practice. So the 3 things you have to hit to qualify: 1, you have to bill out $90,000 or more in claims for Medicare Part B patients only. No other patients insured with other insurances, just Medicare Part B, $90,000 or more within the 12-month period. 2, you have to see over 200 Medicare Part B patients. 3, you have to offer over 200 services to Medicare Part B patients. And this is all or nothing. So basically you have to hit all 3 in order to be required to report your MIPS. Now, there is some fluctuation and some differences in there, and some situations where you might only have to get 2 out of the 3 depending on how you're attesting, whether you're an individual provider, a group, a virtual group. I know I'm probably losing you, but that's why, again, I encourage you to go to the website and the link that I provide in the description to really become familiar with this. But mostly and mainly you have to hit all 3 of those. So you can see if you're a new provider, a new practice, you're growing your practice still, you're not quite sure if you're going to hit those, so you should just assume you're going to. It doesn't hurt anything. So you know those now, and you are aware that you have to have a certified technology, and you have that. So what's the next thing? Well, that's a good question. The next part is there certain categories or other criteria specific to your specialty and your patient population in which you need to be measuring certain data points. Now, throughout healthcare, there are a handful of criteria that all specialties have to measure in a patient's chart, no matter what. And if I can remember off the top of my head, please forgive me, I could be wrong, but I know 1 for sure is smoking status. 2 is race and ethnicity. That might be 2 and 3, they might be separate. And there could be something to do with mental health status. But basically there are some that everyone has to monitor and record on their patient's chart. Some of them are once a year they have to be recorded, some of them are at every visit. So you have to make sure that you really understand which ones are required to be recorded how often. The other one is more specific to your specialty, and this is where providers get to choose basically what they want to attest for. So allergists are going to have a different set of criteria than an endocrinologist or a primary care. Now, based on those criteria, CMS will tell you what percentage of the patient population that you see within the given time frame that those categories would be required to be attested for. So what I mean is, if one of the criteria is that all diabetics that you see within a certain 12-month period have to make sure they've had their eye exams and it's documented, then they will say 85% of diabetics that you see in your practice between January 1st and December 31st of whatever year have to have documentation of an eye exam specifically for their diabetes, and you only get 80%, you can have funds deducted from you if you don't hit that. But the opposite is true. If you at least hit your 85% threshold or higher, then you get a payment incentive and they will reimburse you a check, kind of a benefit check at the end of the reporting period if you've met all your criteria. They score each category, and based on that score determines how much money you will get back after the reporting period. There's a lot of moving parts and a lot of things that influence that as well, but I'm just giving you kind of the basic understanding. It gets a little bit more confusing because in order to know if you qualify or not, Medicare will go back and look at your last 12 months of reporting and another 12-month segment and look at your claims and decide if you hit those original 3 criteria we talked about in order to see if you are a test for your MIPS. I looked up the MIPS determination period because that's always a question for providers, and it says the 12-month eligibility assessment window in which CMS reviews past and current Medicare Part B claims and PCOS data for clinicians, practices, and MIPS-APMs. Each determination period consists of 2 12-month segments. You can click on right now and it will tell you the MIPS determination period for this year. So right now, for 2021, segment 1 covers October 1st of 2019 through September 30th, 2020. Initial eligibility would be December 2020. Segment 2 covers October 1st of 2020 through September 30th of 2021. Final eligibility would be November of 2021. So they reconcile between the 2 segments, and the determination is final unless you've been identified as a qualifying APM, and that's something you need to read about on here. But basically, you'll need to find out which are your segments that you would be qualifying for them to do retrospective claims data looking to see if you qualify. I know this can be confusing and it's a lot of words, but I highly encourage you to look at it on the computer because that's how I learn best, is by hearing and then reading and being able to read it out loud. But basically, you want to make sure that you are always keeping up and updating yourself and your staff on what needs to be collected for your patient data and then what needs to be reported. A lot of times, if you have an EHR that is doing this for you, you have a designated person there that will be in communication with you or your designated person in your clinic about how you're doing with your MIPS and the criteria you specifically chose for your patient population and where you guys are at certain marks during the year. I would encourage at least every quarter to have a conversation with your EHR person and the person in charge of monitoring this in your clinic on site and find out where your guys' weaknesses are and where things need to be stepped up, or where you're doing really well and need to continue doing well. But just looking at it with a month or two left in the year is never good and can be very stressful and usually not super successful. So definitely make sure that you're staying on top of this, you're aware of it, and that you have a really strong communication between yourself and the person on site that's overseeing it, and also between you and your on-site person and the person helping you at your EHR or EMR company if they're assisting you with this. If you have any questions, comments, experience, please leave it in the comments below. I am very eager to see how everyone is adapting to this new status, and if a lot of primary care is seeing it as more of a burden than specialists, because primary care unfortunately seems to really have to hold up a lot more measures than specialists in most cases. So I'd like to hear from different specialties in primary care to see how they feel this is in way of fairness or being able to achieve it in a realistic manner. Want to find out if that link is helpful or if you have any questions after reviewing it, because it is really, really complex, but it's something that needs to be understood, and that's why I'm here. Thank you so much for watching today, and I hope you have a wonderful day.